Good afternoon, everyone. Welcome to our COVID meeting. Today is Wednesday, the 3rd of June. We're going to start directly at the board and let's take a look. All right, here's the state of Florida. We're at 58,000 cases, 10,000 hospitalizations, and about 2,500 deaths. You can see here in our Tampa area that we're somewhere between light blue and dark blue. So Pinellas County right to the left is a little lighter shade of blue. We continue to look really good. You know, you hear me talk every couple of days about Pasco County and how they have been so strong and stable. You start looking at Pasco County here and it's the light beige. So you can see visually the difference between Pinellas and Pasco County. Two important graphs over here on the right-hand side. This is the number of new cases reporting to hospital on a daily basis. And you can actually see way back here on May 4th, this is June 1st. You actually can see this is trending up. So here's why this is important. The number of new exposures, new cases, tends to be still increasing, but now come down and look at the death rate for that same period of time. It very clearly is trending down. So although there are additional cases that are being reported on a daily basis, and that number still looks to be growing, the fatalities are in fact coming down significantly. Again, this is a really important one because it looks at the total testing in the state of Florida and also here in Pinellas County. For the state, we've tested 45,000 people. 44,000 have been negative. The positive infection rate right down here in the corner is less than 3%. So as we do more testing and we get a little further into this process and we start to build that herd inoculation, you're going to see that number continue to drop. You'll recall at one time it was up 7-8%, and so it is going down. It looks more like flu now than it did in the past. That's the infection rate for just standard, ordinary household flu. So those numbers continue to look good. The circle maps shows you the counties and where the outbreaks are visually by the size of the circle. And you can see, just as you might expect, Tampa, Orlando, Gainesville, Jacksonville, Tallahassee, all of the population centers typically have more of an outbreak than any of the areas with fewer individuals. This is percent positive for laboratory testing. So these are individuals with symptoms that are sent to a hospital or physician's office to be tested. You can see that the positive results are declining, good sign. Again, most important here, if you look at the green and the red, they're the sums, the green of people who are testing negative. The red are the number of people testing positive on a weekly basis. And so what you see is the vast number of people who are well or recovering, green, are beginning to overwhelm the vast number of people there in red who are either diagnosed or being treated for the disease. This is what we use to project how we're making progress week over week, month over month. So here's some demographic data here for Pinellas County. One of the things that continues to surprise me, here's the case mix. 739 females, 571 males in Pinellas County have contracted the disease. The median age is 57. And, you know, you always hear on the news that the most vulnerable population are the seniors, but you can see 55 to 64 seems to be, at least in Pinellas County, the most affected age group, followed by the 40 5 to 54, the 25 to 34, the 65 to 74. So we'll continue to watch that and see if there are interesting trends. Positive residents, these numbers are a couple of days old. I'll give you the updates next. All right, we're back at the table here, and I wanted to start with the U.S. numbers and just sort of look back. We have 1,853,000 cases in the United States. Since Monday, that figure has increased by almost 65,000. And so that's a number that I think most of the experts were surprised by. And I think there's a lot of trying to figure out why that number jumped so significantly over just a 2-day period. One of the things that if you're watching TV, I know you probably have heard and are wondering as well, is with all the unrest going on in the United States and all of the people who are out protesting, what is that going to do for exposure? Because certainly good social distancing is not being practiced, and we'll have to watch that over the next 14 days and see if it's going to have any impact in those numbers whatsoever. Here in Pinellas County, we have had 1,335 cases with 90 fatalities. That went up just about 17 over a 24-hour period, so that continues to be rather slow growth, and those numbers look good. Testing in Pinellas County, we're right at 3%, the same as the state of Florida. Here at Regency Oaks, we have tested a total of 15 people for COVID since this started. There would be 10 residents and 4 staff members. Okay, here are the specific numbers for Regency Oaks. Since this whole COVID mess started back in March, we've administered 14 tests for COVID on people who had symptoms. There were 10 staff members and there were 4 residents. Only one of those has been positive. That individual recovered and is now back home. There currently are no residents or staff members showing signs or symptoms of COVID, and we have no test results that are pending. So Regency Oaks and our health center continue to be in really good shape, and we'll continue to monitor that. One of the things that you'll see that's new, it's in both of our lobbies, it's also on the grill and the breezeway, is a new caution sign talking about maintaining good social distancing. I know everyone is certainly enjoying being out on the breezeway and being able to have dinner or cocktails with friends. We want to encourage you to do that, but we want you to also be safe and practice good social distancing. One of the behaviors that we have observed is residents pulling tables together and creating seating for 6, 7, 8 individuals. That is a really bad practice. It's poor social distancing, and I want to ask for residents' support in not doing that. Please limit yourself to 4 people per table. Maintain the distance between those tables and help to make sure that everyone is safe and that we're not spreading the disease and increasing our exposure risk. So if you can cooperate with us on that, it'd be greatly appreciated. So next in our program is a couple of content messages from Jesse, our supervisor of our housekeeping team, and then from Tiffany as well.
Hello everybody, Jesse Rosalie, your EVS director. I just wanted to give you a quick update on what we will focus for the next week. Starting tomorrow, we're going to change our focus to vanity, the bathroom vanities and commodes in your apartment. until further notice. Thank you.
Good morning, Regency Oaks. I wanted to give everyone an update on the transportation department. As of right now, we are still doing the one-on-one personal trips to Publix, the banks, the post office, CVS, things of that nature, but we have stopped the personal shopping trips. If you still need that type of service, I can help you with outside vendors like Shipt or Instacart so that you can still get your groceries another means without using transportation if you're not comfortable yet going out into the community. Thank you.
We'll wrap up today with a reminder at 2 o'clock is the parade. We're going to do it whether it's raining or not, so be out there and wave us on from your balcony. Everybody have a safe afternoon, and we'll see you later in the week.